let's talk real quick. Can you think of one or two areas where we as chiropractors, so I mean, we're not dealing with the C word, we're not dealing with cancer and these life-threatening conditions, but certainly our patients are worried and they're concerned. But where are some areas that you think a good conversation might occur where we can reduce that anxiety? For example, one thing I know that a lot of our people watching this probably have anxiety themselves around and their patients is talking about insurance and the cost and reimbursement, right? Especially if, this conversation of, oh, I have really good insurance. And then we verify their benefits. And in fact, they don't have great insurance according to our standards, right? And so you're going to have to talk to them about there's an out-of-pocket cost here that we need to discuss. That anxiety is building in the provider, probably that anxiety is building with the patient. And if those two things collide, that they're going to spend 10 or 15 extra minutes in that room explaining that, right? Now it's chewing into their schedule, et cetera, et cetera. And I think having a pre-made video about what the heck's a deductible? What is a copay? What does that mean? Sending that out before that discussion of finances based on this research might be a really good idea.
Yeah. And again, that really wouldn't take long to do at all. It could be automated. It could be the second someone schedules a new patient visit with you, that email goes out and explains that stuff to them. I think it's really valuable because then that patient is not walking through your doors and the entire first visit sitting in that chair. You don't want them to be thinking about dollar signs. You want them to be thinking about how am I going to better myself? What can I learn from this provider? How can I get better? So it changes that mental dynamic really, really largely. And, remember, we've studied also that we need high quality thoughts and positive thoughts in order to increase our outcomes even more. So just by a simple change like that, I think that's a great way to reduce financial anxiety as well.
Yeah. And I'm thinking now too, I wonder if you just wrote down your 10 most popular or most common diagnoses, right? Like what are the 10 conditions you see more than anything? And in most offices, it's going to be the same thing. So for you and I, it's facetogenic low back pain, disc-based low back pain, facet and disc pain in the neck, right? Shoulder impingement. What else? Mechanical low back pain, sprains or strains. Like you would come up with a list of your top 10. If you just took those and did like a very short, maybe 2 or 3 slides on something like Google Slides, and then recorded yourself delivering like, hey, the diagnosis, your diagnosis is facetogenic low back pain. Here's what the facet joints look like. That's why it hurts when you lean back. So our goal is going to be to adjust that area and then strengthen your core, blah, 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 blah. We look forward to your next visit, right? How long would it take to shoot that video, put together a few slides, and how many patients will that affect your first year of delivering that via text message, right? Sending a text message automatically with that video attached.
Well, and I also like to remind providers that if you, for whatever reason, are not comfortable making that short video yourself, there are people out there that are doing it. So technically you could use hyperlinks and you can send them resources that maybe you didn't make yourself to accomplish the same goal. It's truly a matter of looking within yourself as a provider. What are my strengths? What are my superpowers? But also finding your weaknesses. Like if you cannot find it within you to make a 2-minute video on discogenic low back pain, that's fine. Find someone who did it well and use that resource that's already out there. But either way, you need to find a way to deliver it to your patients to help with those outcomes.
Yeah. And ultimately, this process will help deliver, build that relationship and that trust between the providers and the patients, right?
Always. I mean, like we always talk about, communication really does matter.
Absolutely. So if you want to improve your patient communication and get 4 times as many reviews, probably based on the fact the review might say, I love Dr. Rebecca. She sent me a video that explained everything going on with me, right? And it's just a 2-minute video. But that's the stuff that gets 4 times as many reviews and 2 times as many internal referrals because people trust you, they love you, and they trust you with their friends and family. If you're interested in that, then check out trustdrivencare.com. Thanks a lot, Rebecca.